Although it's difficult, I get up at 4 o'clock in the morning so I can work out before I head into Boston. I'm on the train for about an hour, so usually I can catch a nap while I'm coming in, which I frequently do, and luckily North Station is the last stop, so I know I'll get off where I need to get off.
So some mornings it's hard because I don't get to see her before work, so I just kind of get myself together. My husband does the morning routine with her, and then I commute about an hour or so up to work.
I'll drive in often and get there before everybody else does. And I enjoy that time. It's quiet time, and I get a lot done.
So how a day goes, I get here in the morning, sign into my computer, I pull up what the infusion schedule may be, I look at what I have for callbacks, I call the patients. I'm the behind the scenes guy, so
I'm a nurse practitioner. I work up at Southern New Hampshire Medical Center.
I am a nurse practitioner in radiation oncology.
And I'm the nurse director of the Yawkey 8 Oncology Infusion Center and the Tamir Center for Targeted Therapies at Massachusetts General Hospital.
When I was young, I wanted to be a Broadway star, but I don't like being the center of attention. I can't sing and I can't really dance, so I decided on nursing, specifically oncology. I mean, I don't know, to me I'm just doing my job. I always try to put a smile on my face, and I'm generally a happy person anyways, because this is a tough area to work. What can happen is your normal saliva. The relationship with patients is definitely pivotal in my choice to stay in oncology. Especially in radiation, you see them at least once a week while they're on treatment, so you do develop a special relationship with people. You find out their likes, their dislikes, where they like to go on vacation. When you're pregnant, they find out, around the same time.
Congratulations.
Oh, thank you.
I didn't see it yesterday. You didn't tell me.
No, I didn't.
Do you remember when I told you?
At the end of the day, I head back home on my hour-and-a-half commute, but I really wouldn't have it any other way. So right now, it's working well.
If somebody came to me and offered me a job that was a mile and a half down the road, my commute would be a lot easier, I would say no. How are you doing, my dear? Are you okay?
Yep.
Okay. It's that enjoyable, it's that rewarding, and my patients are that great. So this is her 7-month picture.
Oh, look at her. Isn't she beautiful?
I had a patient recently where, I knew going in that she was gonna have cancer before her biopsy, and I sat her down and had that conversation, and she said to me something that I feel like I'll never forget, but she said, Nicolette, to hear that you have cancer could have been, the most devastating news, but that the fact that she heard it from me was the best case scenario, and that's when it makes a difference. That's the rewarding piece right there. I would love for it to heal, but you know what? I get to see it every 3 months and make sure that it's okay. All right?
I think I could manage that. I love you.
Oh, I love you too.
Thank you for all you do for me.
Oh, you're so welcome.
I have a very good life. I go to work and I love what I do, and then when I leave, I'm excited to come home and see my family. I get her from daycare, and then we kind of do the nighttime routines. We do laundry, we cook dinner. Jim cooks dinner, I do laundry. Why am I so lucky, and why was I blessed like this when other people are dealing with this type of suffering? But at the same time, I think it absolutely gives perspective on important things and things to enjoy, and that's why I said the best part of my day is when I'm, coming home and I know I get to see her peaceful like this. But that's kind of the day-to-day routine. It's hectic, but we make it work.
my interaction with patients, a lot of times we'll have the first connection with the patient because when they're diagnosed, we try to connect with the patient as a nurse. So if they have any questions, we can answer them. This is my list of when to call. I tell people I like to put a big X through the list and tell you to call me anytime with anything. I'd rather hear from you. If you think you should call, then you should call. So I'm on this managerial path. I was sort of moving away from patient care. And as I was doing that, my mother got breast cancer. So she passed away. And that got me back on the path. Seeing how my mother was cared for, I wanted to do that for someone else. Like today, I spent probably 20 minutes on the phone with a patient talking about their grandchild. That's how you keep it real. It's just listening to what they have to say that day, and help them to deal with whatever it is they're calling you with. 99.9% of the time, I can leave it here. I don't bring it home. We don't know what tomorrow's going to bring. You have to take it day to day. This is your journey. And you get up tomorrow and you deal with what tomorrow brings you.
I honestly feel people who work with people living with cancer have something inside of them that draws them to this patient population. I was, I think, about 19 years old, and I started caring for hospice patients. I'm forever grateful to those families who let me into their homes to care for their loved ones, because I don't know if they know how much they changed the direction of my life. I'm supposed to help people living with cancer and help my staff, the amazing caregivers, treat them with compassion and caring and brilliance, because my staff is brilliant, and love. At the end of the day, try and tie things up as best I can. And then sometimes I'm actually running for the train, and I just tell the staff, look, I'm not running from you, I'm running home to 3 boys. Since my children were born, I wanted them to realize how important the work that I do is. And so they do something that they love to do, which is hand out candy.
What are you gonna give me? That's amazing. Thank you so much.
They feel what I feel. They're gonna look back when they're older and say, I understand why my mom didn't make every game. There was something really important she was doing. But when she could be there, she was there. And when I am home, I'm all mom. 100%. When I became an oncology nurse and one of my patients could not sleep, and it'd be 2 a.m. or 3 a.m., and I would just sit with them, they feel the love that we have for them. So you just feel so fortunate to be there and to be the one caring for them and helping them through their journey in whatever way you can. We do our prayers and they'll ask and they'll say, is it for happy, healthy? Are they sad, Mama? Are they sick, Mama? And they get it. I'm here and I'm ready to go. And I'm gonna give the best care possible today to my patients and their families.
You feel like you're really making a difference with someone, at least helping them get through a little portion of the treatment. So that's why I enjoy doing it.
I don't mind the drive, I don't. Maybe someday I'll get Jim to move to the North Shore, but I don't know when that's happening.
Pretty much, I think you got my whole life there. I can live with that.